introducing yourself, and Erik will figure out what is going on.
Yeah, let's fill the gap with some intros, eh? So, hi everyone, my name is Stuart, I use they, them, and I'm founder and chief executive of Outpatients, but also been helping along with work package 5 of the project. I maybe met some people at the recent event in Brussels, and some other bits along the way. I'll be doing a bit of a talk about my personal journey into my professional journey, and then Levi is going to follow me. So Levi, do you want to intro yourself?
Absolutely. Hey, I'm Levi. I use they, them as well. I'm a bit sick today, which is perfect timing, you know. And yeah, I'm from the Czech Republic. I'm a cancer survivor. And I will mainly deal with my personal experience and some stories that I have got from my friends who are also trans and chronically ill.
And then I think we're going to have space to have a chat at the end, a bit of a Q&A thing, I think there was. So we'll keep an eye on the chat box, and hopefully Eric's sound will be fixed by then to help us moderate that. And if not, Levi and I will do our best, or we'll drag Mags back in.
Is it working now?
Have him save the day.
Is it working?
No, I can't hear you still, Erik.
What the hell? Okay.
Shall I just get started with my section then, and we'll kind of go from there? Okay, also, I'm not very good with Discord, so I'm going to try and share my screen, and if it doesn't work, people please do let me know, but fingers crossed, people can see that?
It's exploding, yeah. Yep.
Okay, cool, all right. If it starts going wrong or anything, people just flail their arms at me, either virtually in the chat or Levi. It's up to you to flail your arms in person. So, as I said,
I'll
my
be
name's
keeping an eye on the chat.
Thank you, Levi. So my name's Stuart, I say them, and I was going to do something a bit different than I usually do. Normally when I do these kind of talks, it's very professional, it's, you know, all of that kind of stuff, but I thought I would actually take a bit of a different angle, seeing as I'm amongst a community. So first things first is Outpatients is a pun in the name. So out, obviously being LGBT, because we're the UK's LGBT cancer charity, we're the only one really. There are a couple of sort of small prostate groups, but when I came and had my diagnosis, I realized there really was a lack of support generally across the whole patient community and cancer pathway, all of that sort of stuff. And I really wanted to see what we could build, but taking it all the way back to day one, this is me as a very young kid with my rainbow knee pads. And I grew up like, you know, most kids sort of in a nice kind of easy life, I suppose. It was just me and my mum, which then made it kind of an interesting dynamic growing up and coming out. I came out quite young. I came out at 13. In the UK, around that time, it was illegal to talk about being gay in schools. It wasn't allowed to be done. So it sort of was an unusual time to come out quite young, knowing who I was, but also learning quite early that it wasn't okay to talk about who I was. And that led me to really struggle with that part of myself for quite a long time. We sometimes call it gay shame, but there was definitely a lot of, I think that I was working through, despite knowing who I was from such an early age. I went to uni, I did that whole thing. You can see on the right, my mom and my dad. You can see I don't know where I get my height from. It's definitely not from either of those. And you can see me with some uni mates on the left. I studied psychology, did a master's in it too, went away, started a PhD, and then after that, I ended up leaving it to tattoo, which I'll come to in a bit. I also, in my early 20s, survived a hate crime. So I was attacked with my partner just by walking down the street, and that led to quite a serious injury of my lungs, and I had to have open chest surgery to fix that. And as part of that led me into my first kind of step into activism, and I guess really addressing who I was as well and taking that on board in a meaningful way. And in this photo, this is me with the Anne Frank Foundation, sort of celebrating people who've survived those kind of events. So as I said, that led me into more community activism, and I think that allowed me to connect with my queer identity and gave me kind of a taste for justice, really, on the sort of a big space. And this was when I was living in Germany, when Black Lives Matter was sort of really kicking off. And then, as I said, I left academia to study. And that was really a fantastic part of my life, to be honest. But unfortunately, it was interrupted by my chronic myeloid leukemia. So I had quite a fun life, I had quite an independent life. I was living in Berlin, was really enjoying everything. And then one day I had some food poisoning, and that just led to some crazy blood tests and a lot of testing, and eventually finding out that I lived with this incurable blood cancer. And from that, I actually decided to go back to the UK, even though I was diagnosed in Berlin, to be in a country that I understood the language, I understood the health systems, all of that stuff. And it was quite difficult because my actual consultants told me I shouldn't go. They told me that I would probably die sooner if I went back to the UK. And that was quite a difficult thing to hear, but also a difficult thing to be away from everything you know when you're going through something really serious like cancer. I mean, I did go back. I thought I would find all the support I was looking for. I thought I would find the LGBT stuff that I needed, and the way I could bring my identity into it in a way that I'd sort of only recently come to terms with through that sort of social activism stuff. But I didn't. There wasn't really anything there at all. And after years and years of trying, I still didn't find anything. And that really affected my mental health in a bad way. I really did suffer with that isolation part, and really did struggle to sort of marry the parts of my identity and my healthcare experience. And it got to a point where I actually decided to raise this with the people around me, because I was kind of frustrated about suffering in silence. And I actually took part in research, which gave me the first opportunity to marry those things together. Talk about being LGBT, talk about having this cancer. And then after that, I went to speak to Lindsay here, who you can see in the photo, who worked in the cancer center. And I just said to her, like, look, I need to speak to people like me. I need to get something going. It's important for me. And she was so supportive and threw her full weight behind me. And that was really powerful. And it really allowed me to kind of step into who I needed to be in that moment. And that led me to doing this stuff professionally. So I was able to pull on that kind of experience I had of academia. I was able to pull on the experience I had of, you know, being an independent person and building something from the ground up. I learned from tattooing. And then also my patient and lived experience to lead me to set up the charity, but also then speak nationally and internationally at conferences, which I continue to do, as well as running the charity. And do campaign work in the community as well. So that idea of community activism that I kind of grew to love, I now get to do as part of the job, and sort of really raise this across the country to improve our community's health and outcomes. Now I'm going to sort of bore you a little bit with some of the stats just to sort of justify why LGBT stuff is important, because a lot of that story is the personal, but there's also a lot of the medical and the clinical stuff as well. So in our community, we're more likely to smoke, more likely to drink. We have higher rates of HPV and higher rates of HIV, so viral infections. A lot of this is considered related to something called minority stress. So the stress of being an LGBT person in society can lead you to higher risk behaviors. But it's important to know that these things are there. This means that when you think about incidence and how often cancers show up in UK biobank data in LGB people, lung cancer is the one that has that higher incidence rate, again, similar to the smoking thing. But if you look broader than the big four and you look at all the other cancers, you can actually see that there's loads of different cancers our community is saying there's potentially higher rates of. And again, some of this might be that virally driven stuff. There's always the big question about, what if you're trans? What if you're on gender affirming care? And what does that do to your cancer risk? So we have some studies out there. We know some stuff, but we want to know more. But Trans masculine people on gender affirming care tend to have a breast cancer risk reduction, either from hormonal care or from top surgery. Trans feminine people, if they're on estrogen, are going to have a lower prostate cancer risk, but they're going to have a higher breast cancer risk. So a lot of nervousness, I think, comes around talking about trans health, but it's important we engage with it and make sure we understand that it's not always an elevation of risk. Sometimes it can actually be a protective factor in cancer. But this also ties into screening inequalities. So we see a lot of these in the UK. So especially around the way that our systems work. So invitation to screening programs is based on how your gender marker is on your clinical records. And it's really difficult to work around that. And it's taken, I would say, at least 6 years for the NHS to try and find a solution just in cervical screening, and they still haven't released it. They've been working on it for so long, and it's just, in all that time, people are just going without life-saving screening and potentially getting later stage diagnoses, and it's really important we fight against that. Patient experiences as well, it's not just my experience. We're going to hear from Levi in a minute, but also we have data from a national survey we have in England, Cancer Patient Experience Survey, and year after year it shows our community has poorer experiences. One of the things that comes up often in that survey is the lack of the ability to have our loved ones around us. So our relationships, our chosen families, our partners being given the same level of respect and support as other people's are. And also in the UK, this is, a bit of a content warning, but the UK is in a quite steep backslide in relation to LGBT rights. Things are getting worse as they are across Europe and around the world. But in the UK, it's really taken on quite a strong push, and a lot of this driven is by social politics. And that's been really difficult to watch in the community as well, and see literally story after story, day after day, come out against our community. And it's my opinion that we've entered a phase where healthcare has become a hostile environment for trans people. It's never been great, let's be honest, but in the UK, we're in a position where it's actively getting worse, and there are people who are pushing for it to get worse. So this is a time when not only is our community quite stressed and we're fighting against all this stuff, but it's a time for us to call out the allies to try and help make sure that they can stop this erosion of our rights. In the UK, we often are seen as sort of people who are quite good at this stuff, but actually, if you look at where we rank internationally on the Ipsos survey of LGBT report, actually, we're right at the bottom of the list when it comes to trans people being able to access single-sex spaces and facilities. And at the moment, they are trying to rewrite the NHS constitution to be able to ban trans people from certain parts of hospital. It's really grave times, and it's, awful stuff to say, but I think we have to say it so we can talk about it and we can find ways to challenge it. But on a more positive note, what do we do? What do I do about it in my day-to-day life? So support patients is one of them. So we have on our registry at the moment, we have just over 180 cancer patients who are LGBT, about a quarter of them are trans and non-binary. We have about 40 partners or supporters and carers who have their own ability to access support, and we're just looking at restructuring that now and seeing what we can provide for them. Is it going to be something like you provide here, an online community? Do they want more in-person stuff? We're actually this Saturday trialing our first ever in-person breast cancer support group with a local centre. Good, exciting stuff. People love our support, which I'm really grateful for, because it's, I built the thing that I wanted and needed, and I'm glad other people get to benefit from it. So one person described it as so queer, so inclusive, so open-hearted, so supportive, and I couldn't wish for anything more from that. We raised visibility. So on the top left, if you were with some Brussels, you'll recognise that view, but whether it be European Parliament or whether it be on the top right, which is UK Parliament, whether it be international conferences like One Young World on the bottom left, or even supporting our patients and our support community members to go and speak for themselves at these conferences. And that's the bottom right, where we helped one of our patients go to a Macmillan conference and share their experience firsthand. We create really cool campaigns. So we try and actually bring our community directly into health messaging. This is the one that we did about breast screening with the NHS, and it was really great. And it was actually the trans model that was the most popular. And I think it really shows the power of having real people be the front of the message. And we make sure we stick these things like directly in the community, you know, make sure that it's not just online in some corner of the internet. This is talking about things like identity, pronouns, and so on up front, right in people's faces. And making sure it's in everyone's faces, making sure we're intersectional. This is us at UK Black Pride. LGBT issues sometimes get put just in a white space, and that's obviously not the case. So it's really important for us to go to UK Black Pride and work with Black organisations to make sure we have good representation. And also our campaigns always have good representation. We have a good broad variety of genders, ages, identities. It's really important we're able to do that. And we tend to sort of piggyback on the NHS's interest in getting people screened and diagnosed early. And we really try and push the idea, you know, let's get LGBT people into that message too. Again, putting it in public spaces, like, and not just in London. So this is in the north of the country, in Leeds. So making sure that we get to sort of burst that inner city bubble and just make sure people understand that, you know, this is a national issue as well as an international one, really. We publish lots of information. So whether it be a booklet that we've done nationally with Macmillan, whether it be radiology guidelines to support trans people from being irradiated whilst pregnant, whether it be published research in journals, whether it be chest checking posters, the lot, you know. We've only been around since 2020, but I've been working really hard, lost a lot of hair, but managed to get a lot of stuff out there because it was really needed and continues to be needed. One of the most recent things we've done that I'm really proud of is we've released the Sex and Cancer Info Hub. So if ever you're going through a bit of treatment and you're thinking, how is this going to affect my sex life and intimacy? We might have written about it. So take a look and see if it's there. If you need more information, give me a shout. You know, this is a new direction that I'm really keen to be stepping into. So really exciting stuff coming there. And we educate healthcare professionals. So we do talks a bit like this, but maybe without the photo of me on a skateboard at 3 years old. And people describe it as informative, inspirational, interesting, and we reach usually between 1.5 to 2,000 healthcare professionals every year with this stuff. So really, you know, one step at a time, trying to change the conversation. We also do our own conference. So if you're doing a project or you want to come and talk about this kind of stuff, we'll keep an eye out. We should be doing it towards the end of the year. It's a really nice way for people to connect and to actually find routes for funding and more projects as well. That's a really exciting thing. And that's me. So I've tried to keep it short. So we've got enough time for Levi's talking questions. So if you've got any questions, you know, pop them in the chat and I'll answer them later or we'll pick them up then. But thanks for the opportunity to tell you a little bit about what I do, my day job, what keeps me very busy. And over to you, Levi.
Thank you. Beautifully said. It was really, really cool. It was awesome to see what you're doing and how you're helping. It's truly amazing. Thank you for that. Okay. Can you see my screen?
Yeah, it's up there.
Yeah. Oh, okay. Very well. So, hello. Levi. I use they them pronouns and will arguably not. I'm arguably not as helpful to the community as Stewart, but I will still try to shed some light on being trans and how being trans with cancer and post cancer, how that all correlates. How this will work, I will first introduce myself to this topic, lay out the basics such as myths and basics of my story. That will be the main part. Then I will move on to gathered stories, which will be a story of one of my closest friends who is chronically ill and also trans. And then there will be space for questions. So, hello, that's me over there in the picture with the non-binary flag. I am a cancer survivor and non-binary. What being non-binary means is that I'm not necessarily a man or a woman, but to put it very simply, somewhere in between, even though that isn't exactly it, but the conversation would be held for could be held for hours. I put the point of being a Pokemon enthusiast just to show you that I'm just a human. We, like, as trans people, we are also just humans. We have interests, we have loved ones, we have families, friends, and we're just like everyone else, just trans. Now, here are some misconceptions that I have heard, or my friends have heard, when dealing with healthcare professionals and dealing with mental health professionals, or just general people. The very first one is that cancer has a direct effect on being trans, which simply isn't true. I have heard this both ways. It can be interpreted both as, oh, if you didn't have cancer, you wouldn't be trans, or because you had cancer, you cannot be trans. Neither of these are true, because not all cancer patients are trans, and there are cancer patients who are trans. So it is simply not true to say that just because we have cancer, that has a direct effect on our gender identity. Cancer survivors are happy all the time, and we love being alive all the time. That is also not true, because yes, we are happy that we survived, cancer patients, as many of you know, because I believe that many of the people here in the chat and people who will maybe watch this later as a recording had cancer, so you know that we are still susceptible to depression, anxiety, and things like that. So whilst it is awesome that we were given a second chance on life, that doesn't mean that we are upbeat and super happy all the time. On an opposite note, trans people are miserable all the time, and we hate ourselves constantly. Now, it is true that we as trans people very probably feel sadness quite a lot when it comes to gender dysphoria, which is the feeling uncomfortable with how other people perceive you and how you perceive your own body, and how it doesn't align exactly excuse me, how it doesn't align exactly with how you feel. That doesn't mean that we feel this constantly. No, in my personal opinion, being trans can be one of the most beautiful experiences a person can have, because once you start living your true life and you find people who support you, you start getting treatment that you want to get, it can be freeing and so amazing that it is baffling to me to think that some people think that, oh, you're trans, that means sad all the time. And last, which was very interesting to hear, cancer survivors cannot be trans. I do not know what went through the head of the person who told me that, but some people may think this, and I'm here to say that I, any other people I know, are living examples of that not being true. Now, I will get into my story, personal journey. I was born and lived for 9 years as an energetic social kid. I was going to public speaking competitions. I loved presenting things for people. I loved saying poems. I loved dressing up. I loved everything. However, I felt different. I can't really say that at the time I was sure, oh, I am non-binary. No, because I didn't have the language to say it. But I knew that something was amiss. I knew that something was wrong. However, at 9, I was diagnosed with sarcoma, which is a rare type of bone cancer that is very, very deadly. And according to the research I've done, in patients from years 10 to 15, I believe, the survival rate when Ewing sarcoma metastasis is 39%, which happened with me. I had metastasis in lungs, so I couldn't properly deal with being trans while I had cancer, because yes, I still felt different, but I didn't feel like it was what I should be focusing at at the time. I didn't have that much time to really develop in some parts of life, and I had to develop super fast in other parts of life. Now, this, I believe, is a shared experience with a lot of not trans, well, with trans patients as well, but with cancer patients, that we didn't have time to really connect with our peers, but we had to learn about death, mortality, and things like that a 10-year-old child couldn't deal with. So, as I said, I had other important things on my mind other than directly being trans. I, of course, had to think about I can die any day, which isn't a really fun thought to have at 10 years old, but I had those thoughts a lot. However, I still felt weird being addressed as a man when doctors came and said, "Oh, you're such a strong guy. Oh, big guy are you? Oh, you're just like big man that you can deal with this." It felt strange. It felt correct. At the time, I was just keeping this very quiet. I didn't tell to anyone that I'm not entirely too comfortable with being addressed like this. But again, I had other important things I had to focus on, so I just pushed it back and I told myself, just go with the flow, something will happen. I got out of the hospital at 12. Now, I wish I was able to say that I was happy at the day when the doctors told me that I'm cancer-free. I was happy, don't get me wrong. But it was at 12 when the gender dysphoria, the feeling that something is fundamentally wrong, started to hit. Yes, I was happy that I'm no longer actively dying, but I didn't feel extra awesome. And as one journey ended, another one started to begin. I started to name issues. This went on as when I learned that trans people exist. I learned of this band where the main singer is trans. She's a trans woman. And when I learned about her story, I thought, oh, I feel that. Is that something that normally happens? Does everyone feel this way? And surprise, surprise, not everyone feels this way. And I had to get over so-called internalized transphobia, which is when when you're trans and you start and want to transition, you deal with things like, oh, trans people are bad. I cannot be trans. I cannot be trans because this is just wrong. So getting over that was a major part of my journey. And I would love to talk about this more, but I'm afraid I don't have that much time. But okay, because internalized transphobia is, again, a topic for hours of debate. And I would even venture on to say that every trans person, at least that I know of, and I know quite a few, has issues of, I cannot be trans because trans people are bad. Because that a lot of conservative people, and sometimes even liberal people, tell you that trans people are dangerous. However, that didn't stop me from naming my issues and starting hormone therapy in 2020. I was 16 at the time, or 17, just on the edge of 17. And I had to go through loads and loads of uncomfortable tests to confirm that I was really trans. I had to go to different psychiatrists, psychologists, sexuologists, who all had questions that to this day, I cannot believe they were asking young people, 16-year-old kids, or sometimes 15-year-old, 14-year-old that I knew as my friends who were going through the same thing. I was at that age asked about my sexual history. I was asked about masturbation. So things that really couldn't be asked because I feel like it's too personal. And while yes, it can shed some light on identity, I don't think that the amount of these questions was really necessary. However, after all of these were confirmed and I was able to start hormones, I changed my name. I will not share my legal name for reasons that I will not also share, but I had to change my name from the so-called dead name, which is the name I was born with. And in Czechia, we have this law that you cannot change your name to a strictly female name if you were born male, and vice versa. You cannot change your strictly male name if you were born female. So I had to find a neutral enough sounding name. And that would be about my story. I am now happily living as Levi, and I'm taking hormones, and I'm out as non-binary to basically majority of the doctors that I regularly visit, which because I have cancer is quite a few. So as I said, I couldn't be happier. I am incredibly lucky to have a support system that I have, my family, which I realize I'm incredibly privileged to be able to say these things. Because as in this story that I have of my friend Laura, she unfortunately cannot say all these things when it comes to medical professionals. She was diagnosed with multiple sclerosis, meaning her brain doesn't properly transfer electric signals to limbs and other parts of her body. When I was talking to her about this presentation, she told me that a lot of the doctors that she goes to were inexperienced when it comes to trans people with chronic illnesses. And legal system didn't offer much support in terms of finding new doctors or dealing better with how she was treated. However, when I asked her if, as was one of the myths, if she didn't have this, would she still be trans? And she said a beautiful sentence that I feel like should be shouted into the world. There is no scenario of not being Laura. And I absolutely love that because I feel like that is with a lot of people who are chronically ill or after a serious illness and are trans. There's just no scenario of us not being ourselves, whether society likes it or not. And now I have a brief touch on how not to treat trans patients coming from my experience. Again, a lot of these happen on the daily and they are just simply not okay. First and foremost, forcing coming out. As Stewart said in her presentation, this coming out is when you are supposed to tell other people that you are trans, queer in other ways. And some doctors do force this to tell our families or them themselves when it's not directly related to the case, which isn't how it's supposed to work. We're supposed to come out on our own terms, but sometimes it is not the possibility. Also, inappropriate questions unrelated to the case. Now, I want to stress unrelated to the case because sometimes questions about body and sexual history are important. However, and this goes with my next point, which happened, and this is kind of a horror story, basically horror story regarding a visit to my doctor's. where after taking estrogen for about 2 years, in 2022, I went for a checkup to my oncologist, and he basically asked me to show him parts of my body which just don't. If you ever, are with a trans person, are a doctor or just someone, don't ask trans people to show you their bodies. It's very uncomfortable, very unprofessional, and inappropriate. Also, as I was mentioning, Laura's story, do not directly connect being trans to other health issues we might have, because being trans doesn't affect our physical health until we, let's say, get surgery or hormones. Simply identifying as another gender doesn't cause us to suddenly spring up certain illnesses. And please do not treat us differently just for being trans. This goes both on too harsh and too kind. With too harsh, it's obvious we don't want to be treated as lesser. But with too kind, this also often happens that we are treated like children who need to be protected at all costs. That is also very not okay. And now some closing thoughts. Trans patients deserve equal treatment as cis patients. This should go without saying, but it's often not the case. As again, as Stewart said, it's in many countries, it doesn't really work this way, but it absolutely should. And I would very much like if there was more activists and more people pushing for this very point to happen. Being trans is not a disease. It is simply not. It was considered one, and still some people consider it as an illness, but it simply is not. And one final thing, that if you had to take one thing away from this presentation, please take that. Please be kind. Thank you. That is my presentation.
That was amazing, Levi.
Yes, it was
Thank you.
very
Thank you.
interesting and very powerful story. Thank you for sharing.
Thank you.
Yeah, thank you also, Stuart, for sharing your story and your work. It was very inspiring, both of stories. I even I feel touched, I have to say. And yeah, it's really amazing to see both of you in our community. Yeah, so we have a time now for questions, maybe, if we have some in the chat. I can see. I mean, you have to read the chat because there is a lot of support for both of you. You
Yeah,
have
I'm
to.
reading back. It's amazing.
Yes, yes. Yes, and also Erik is recording the meeting, so you will see.
Amazing, amazing. I see Carmen, Charmander, amazing. I'm more of a squirrel person, but Charmander is
I'm
also
with
amazing.
my heart, I'm Bulbasaur. Like,
We have the whole trio here. Amazing.
yeah.
I say the original starters, like that's reassuring. Because now it's like all the way to like Diamond and beyond. There's so many that I don't know, but the original ones I still remember. I mean, it makes me feel really old when you think about like the original cassettes and all that kind of stuff. But
Yeah. I don't even know that there are new ones. Oh, we have a question for Levi.
Oh, question.
Yes, for you. When you have
Yes.
you
Felt
felt
truly
truly
supported for
support.
first time via friends. Oh, it was via a friend that I came up to him. Basically, I got a bit drunk and I told my friend that I told him that I just don't want to be a guy. I'm not one. And he said, okay, so should I call you something else? And I was like, yes. And I started crying. And he just said, oh, sure. And that was the first time that I truly felt like someone understands. Because beforehand it was just, oh, trans people are others. They are different. And but I am one, and I do not know how to deal with this. So, but when my friend told me, okay, this single word changed the world for me. So that was the first time I really felt like there is hope in this world. And that's also what I really want to um, that's what I really want to tell other people who might be struggling. There is hope in the world. There are people, yes, there are people who are kind. Not everyone, but there are people who are kind and who are willing to help. Okay, I see another question.
Yes, from Erik.
Stuart, do you want to take Erik as well?
Yeah.
Because I see one from Mel as well.
Okay.
What's the most challenging part of coming out trans? Stuart, do you want to take play? I talk all the time.
Yeah, no worries. So I think you raised a really good point, Levi, about the fact that like it sort of takes time to sort of figure it out in yourself and then share it with other people. And I think the coming out thing is always risky. It always feels scary. And I think a lot of times some people get that and some people don't. And some people think it's a case of like, oh, but you're just telling me who you are and that's great. But there's always that risk of like, well, is it going to land well? Is this person going to respond badly? All that kind of stuff. And you can have that, whether it be with family or friends or even with your doctors and nurses. And I think that's where it's really important. The challenging part is always, I think, the fear of someone else's reaction rather than the being honest with yourself, because that part we've already figured out. And like even sort of me figuring out the sort of non-binary thing, especially because when I was younger, the language wasn't around, and you just always felt different, but you kind of always assumed everyone else felt the same. Everyone else queer felt different in the same way. And the more I spoke to other people, the more I realized they didn't feel the same way. And that I think took quite a bit of time to kind of then understand and process. And definitely having cancer really like picks things up a notch to kind of think about like, okay, well, how do I really want to live my life? Like what parts of myself do I actually have to get real with? But it's difficult sometimes, especially being in the non-binary space, because people, when you're not a trans man or a trans woman and you're sort of in that kind of sort of middle part that Levi was describing, you get misgendered so much all the time. Like I get it all day, every day, from family, friends, and colleagues. And it's tough because I'm meant to be doing this job and being the person that's like at the top of it and, leading the charge. And there's days when I can't even be bothered to correct people because it's just exhausting. So to kind of go to someone else's point about like what can allies do for trans people, I think understand that support, it takes lots of different ways. Sometimes it's like healthcare, sometimes it's the pathway, sometimes it's the change, and sometimes it's just checking in, and like how you're feeling lately, like the news has been kind of bad lately, or what's been going on, or I heard this thing. Or if you see someone being misgendered, either asking if you need them to step in and speak up for you, or see if you can kind of talk about it and decompress afterwards. And I think that's always a really helpful thing for me when people are able just to kind of just check in and be like, I've noticed this is happening. Are you all right? Do you need some help? Do you need some support? But to Levi's point as well, not overcorrecting. You don't always have to come in as a savior, because then that can sometimes take it to another level that can feel really difficult to navigate. But just checking in with people can be really important from a medical as well as a personal context.
Yeah, exactly. It's really important to make trans people feel seen. That we are, as I said in my presentation, we are just like humans. And so as you would check up on your friends and be like, hey, what's up? Just ask us what's up as well. I hope that didn't sound too like, but yeah, just we are people, so treat us as people.
Yeah, there are, and I think Levi makes a perfect point in that to check in with someone who's trans non-binary, you don't have to be an expert in trans non-binary health, identity, politics, anything. Just check in with the human part, like and just build those connections and friends. And I think also a lot of the stuff like the sort of pushback against trans rights and stuff is because a lot of people, when you hear the way they talk about our community, they talk about us in a theoretical way because they don't have any relationship to us. They don't know us as people, and they almost in a way need to not think of us as people to make what they're doing acceptable. So the more that you can kind of remember that we are people at the end of it, I think humanizing that perspective, and also recognizing that although we talk a lot about representation, and there's obviously a big drive in LGBT rights about representation and that kind of stuff, visibility doesn't always mean safety. So the idea of sort of trans day visibility and all that kind of stuff is one tactic, but it has to absolutely be backed by vocal support from a wider community as well, because otherwise you're just sort of asking trans people to be visible out there on their own, and they sort of, we need to kind of feel that there's a community of support around us.
Oh, there's another question specifically for you, Stewart.
Yeah, there's some. I saw some talking about how do we sort of make changes in other places, and then Katie just put one in talking about the white paper. We've done some stuff. Yeah, any of this kind of work to go Europe-wide. So this is the interesting thing. So, I set up Outpatients and it's kind of grown into what it's grown into. It's sort of snowballed, if I'm honest. But when I started it, I didn't even know what charities did. I was sort of on the outside of it. It wasn't even my idea to start a charity, if I'm honest. People around me said I should. And I was like, all right, I can't tattoo anymore. Let's see what this does. And then it's grown and I've learned a lot on the way, a lot. But in doing so, some people have turned around and said to me, like, oh, would you ever, kind of like, franchise, would you ever make a copy of the charity or set up a new office in another country? And that's, I think, not the best way to work internationally. I think the best way to work internationally is if I'm able to share my skills with people in their own countries to build their own thing. And then we can make a network and it can feel more like we're sharing power and we're gaining support together rather than, it will have to come from one place, because I think there's such small variations in the way things have to work in different countries from a legal perspective, from a social rights perspective, from a language perspective, all of these things. So when it comes to the Europe-wide stuff, I think having documents like the white paper we wrote is useful because then it becomes a almost backbone that people in their relevant countries can refer to try and then build around that what that change looks like for them. And if anyone in this call or watching it later or even, however far down the line decides, yeah, I'm going to build that thing, I'm going to build that charity, I'm going to build that patient group, I'm going to build that advocacy, whatever, pick my brain. Like it's here to be shared. I'm proud of what we've achieved, but I'll be more excited when I see other people achieve it too, and that we can create a unique voice, because then also it will challenge the idea that LGBT stuff is just a Western European thing. LGBT people are everywhere. So we sort of have to find the mechanisms by which we can raise those voices. And this is where I think YCE and ISNet and stuff is really good for that. It's really good to give people that platform. But I'm keen, Levi, to hear your perspective from what it's like being someone vocal from, a part of Europe where that's not always the easiest thing to do.
Well, over here, it's in Czechia, it's not ideal, but I feel like it's on a good way. There are some recently, actually, in our second, they opened a doctor's office, specifically for trans patients. I'm not entirely too sure how it's called in English. There is hope. It's on a better way. And as you were saying, like, I actually once I figured out other things, I was looking to start something here, because again, I have like friends that are very active. So once I solve my health issues, I would love to start something, because the change is needed. It absolutely is. There is a severe lack of medical information about trans people. There are luckily some organizations that help trans, like generally LGBTQ plus people. In most major cities, there are queer organizations, but it's nothing like official, or where they would have, as you shared, that you have posters out in the wild, if I say so. It's more, there's an Instagram account that's like, hey, do you want to meet up? And some people meet. But I was actually really inspired by you and your story. Now, after this, it really cemented that I'm really looking to start something to help people be themselves and have some support.
Yeah, sounds amazing. I'm really excited to see what you build, and I think the more that things get built, the easier then they can plug in. So obviously, if it's cancer specific, there's this network, there's European Cancer Organization, there's other places, there's ILGA, and I think interestingly in the kind of policy and advocacy stage internationally, LGBT rights is becoming almost a fashionable topic. So it's sort of how to grab that and make it meaningful. That's the thing I often think about a lot. How do we move beyond just representation, and how do we get into, like you were saying, Levi, the medicine, the science, the findings, the research, the gender clinics? How do we build infrastructure that kind of moves things forward? Lovely to see you, Katie. It is that point where, give an example. I'm a bit messy. I love a gossip, so I don't mind sort of sharing things. But UICC in their World Cancer Day, in their last report, they released a report with an LGBT person with like a pride flag around them on the front page of the report, and I was really excited because I thought, oh, how cool is that? Finally, someone else out there doing some similar stuff. Went through the whole report, and there was not one LGBT project. And I had a go at them about it. I sent them a bunch of emails, they never responded. And then when they reached out to me a little bit later, they were like, oh, we'd love to work with you. I was like, funny, because I got a bone to pick with you, and I want to tell you exactly what I think about what you did. Because I think sometimes when you're in any minority community, you're made to feel like you should be grateful for anything you get. And that can be a really difficult position to be in when all you're really demanding is the same level of respect and care from others, and you have every right to demand that. And a lot of people see inequalities work as, like there's only so much money to go around and blah, 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 blah. And it's less about, I think, the budgets and the money and the bottom line. It's about the priorities. And when you're a minority, you often aren't a priority. So how do we shift that into real change, but change that builds infrastructure, so that if we fall out of favor, if we become less fashionable in this kind of EDI thing at the moment, we'll have infrastructure that means they can't get rid of us. We won't be forgotten as we move forwards.
Yeah, absolutely. Yeah.
You want to share something more? Go on.
I don't think so. I just like yeah, I'm speechless because I'm really happy with everything that's been said here. It was really really awesome.
Yeah, I think
So
Yeah,
thank you for the
it's
opportunity
also
to have this event.
yeah, and thank you for the opportunity to meet you, Levi, as well, and for you to share your story. Like
Thank you.
it's the cool thing about this network is that not only do I get to meet so many of you really cool people, but you get to meet other queer people with cancer, which doesn't happen every day.
Yeah.
we're all very.
It really helps to. Oh,
Go on, go on, go on, go on.
okay. It really helps to see that it's always important to find people who are like you. And with this, I would like to thank everyone here in the YC organization that it's just bringing people together. It's amazing what you lot do, and so thank you. And now I will shut up.
That's okay. I also hope going too fast. So I want to say thank you to both of you for sharing your story, for like getting the initiative for this event and sharing the stage together and being in this community. Very strong points, because I know how much it takes to share your story and experience and even discuss it after all. So yeah, it means a lot for all of us. And as you can see in the chat, we are very thankful for you. And yes, I think we have this wrapped up. It was an amazing hour. Also, I want to remind everyone that you can register for 2 events that we have. Also, one of it is EDI training, very important and actually amazing opportunity to maybe level up your own skills in this topic and in EDI, or maybe just learn it, because not everyone is very aware in every topic. So maybe this will be even more helpful. So thank you again, everyone, for this evening, and I hope you have a great weekend. I mean, we have to work like 2 more
I was
days.
going to say
But
it's only
still.
Wednesday. I wish it was the weekend.
Yes, I
Yeah.
know. I know, but I'm thinking about the weekend already.
We'll get there. We'll get there.
Yes. And we see each other also tomorrow for the event with Mel that is in the audience for a Canva event, working on our CVs. So yeah, it's a lot. Thank you very much again, and have a good night.
Thanks, everyone.
Have a good night yourself.